There are at least 6 or so cases of the UK variant of COVID-19 in New York State. 1 here in Onondaga County, 4 in Tompkins County. Let's find out more about that situation. We're joined now by Tompkins County Public Health Commissioner Frank Krupa. Frank, thanks for being with us.
Thanks for having me.
So let's start with that UK variant right there. At last check, according to the state, Tompkins County had recorded 4 cases of the UK. Have there been any more? Are those related? Does it seem like you've got it boxed in?
Yeah, no, those 4 cases are still what we have identified. 3 of them are connected to each other. It was an international travel and their housemates. The other case was independent of those 3 and separate. So we still have the 4 cases.
How concerned are you that this variant or any of the other ones that are out there now, the UK has shown up in your county and could eventually be the dominant strain, and others may come as well. So what's kind of your concern level there as we start to see cases drop, people getting vaccinated, et cetera?
Well, we're certainly still concerned about COVID in general. Obviously, there's a lot of attention on vaccination, and we're putting a lot of effort to that. But we really need our community to continue to be vigilant on following the public health guidance of wearing a mask, social distancing, decreasing density, and such. The variants are coming. We're aware of that. We're going to monitor them. But right now, we really need folks to keep following the same guidance we have been for the last almost a year now.
It's been a bit of a, I'll call it a smaller roller coaster the last couple of weeks as far as active cases, up a little bit, down a little bit, back up a little bit, but certainly way down since the holiday surge. Where would you say you are right now in terms of cases in COVID in Tompkins County?
Yeah, we're definitely on a bit of a downswing after the holiday spike that we saw. Of course, we did just have Super Bowl weekend, which is very similar to what caused the holiday spike. So we'll see how that evolves. And we've also seen our higher education begin to re-engage for the spring semester. So we're monitoring closely with our partners at higher ed on cases that might be coming into the county because of that return and keeping it under control.
Yeah, speaking of that, I'm thinking Cornell University, obviously Ithaca College. Cornell was there last fall, but Ithaca was all remote. So now you have both schools with in-person learning there. How big an impact is that going to have COVID-wise on your community?
Yeah, well, we're really fortunate that Ithaca College, Cornell, and Tompkins Cortland Community College have all been really great partners with us. They put a lot of energy into trying to do this as safely as possible. Most of Ithaca College's students live on campus, which adds an added level of a kind of control for that community. And we'll continue to work with them over the semester to make it go as smoothly as it can.
What has been, and everybody's in a race to get as much as they can, what's been your access to the vaccine? I mean, how many people are able to get it? How many people vaccinated? Just general, how are we doing vaccine-wise?
Yeah, we've been really fortunate that we were able to stand up in the beginning of January our large-scale vaccination site. So we've vaccinated over 7,000 people to date here in Tompkins County. We've demonstrated that we have a capacity and a capability to do large numbers very quickly, and I think the state has recognized that. So we have been fortunate to get allocations here each week, and we'll continue to provide those as quick as we get them.
Lots of people trying to get appointments. What's your advice to, the folks that are struggling to, lock one down?
Yeah, that's the question of the day. I would encourage people to keep looking for the state sites. Those are the places where everyone is eligible. Here in Tompkins County, we've been prioritizing within the essential worker group and working through employers to make registration links available to those people that we're making eligible each week to try to add a little structure to the process. So we just encourage folks to continue to be patient, look at the Tompkins County Health Department webpage. There's a lot of information there, including who we're currently prioritizing for vaccinations.
You talked about this a little bit earlier, but maybe kind of bringing things home again. Your cases are down some. You do have more people getting vaccinated, 7,000 you said. But how important is it? How much do you have to drive home that we still need to keep wearing masks? We need to socially distance. All those things that, we have been doing to try to, conquer this virus.
Yeah, absolutely. That's still the most important message. We're doing a lot of conversation around vaccine these days, but the most important thing we still need to be focused on is those public health interventions, wearing a mask, social distancing, hand hygiene, reduced density. Those are really what are going to carry the day while we watch the vaccination process unfold over the next few months. So we'd encourage folks to please continue to follow that guidance, be patient with us on vaccines, and we will get to the end of this.
All right, Frank Krupa, the Public Health Director from Tompkins County. Thanks so much for being with us tonight. Appreciate it, Frank.
Thanks for having me.